Hello friends, today I'm going to talk about pharmacies and how important they are within the community. And please love your pharmacies, love your local pharmacies, and go and help out. Go and work there and understand what goes on. With pharmacy teams overstretched throughout the pandemic, extra junior staff helps reduce this burden. This is an opportunity to create more jobs in pharmacies. Working in a pharmacy offers high quality jobs and an opportunity to become very skilled quite quickly. A retail apprenticeship in the pharmacy is an option that combines training and employment. So if you're a person looking for an internship, try your local pharmacy with a job application. Pharmacists are overworked and some of them turn to spirituality and meditation like me to relax. Work-life balance is a struggle for some of us, and by spending time with the children, we get happiness and a little bit of satisfaction. Pharmacists have gone beyond the call of duty during this pandemic. They have put their training to good use by supporting patients and communities and ensuring that essential services are not disrupted. As a pharmacist, it is incredibly important to mentor those working around us. Encouragement and confidence can provide essential fuel for the development and motivate you to exceed your own expectations. So please go and support your pharmacies. As a mentor, I usually spark conversation that focus on what is possible and then unblock the tools to achieve that. It is very important to know your purpose. By aligning with our purpose, we can understand our path of development. Having a good support group of people who will talk to you without judgment is also very important. A meaningful conversation can be so resourceful, thought-provoking, and inspiring. Self-development is an ongoing process. Develop your vision within the pharmacy teams. Consider how you will achieve your goals. Supporting and helping individual team member helps us reach our potential and helps them reach their potential. We try to think outside the box and set out a purpose, get a clear vision, and set goals for ourselves and our teams. Pharmacists in community have got to be excellent communicators. No wonder doctors and pharmacists take a bit more time than normal talking to people. In community pharmacies, we provide a supportive environment that reflects on safety, comfort, confidentiality, dignity, and respect. We use patient medication records effectively and also look at clinical records during our consultations in the pharmacy. Along with the administrative task of consultation, time and resources are also managed effectively. We first achieve meaningful consent and agreement with the patient for any medicines management plan or for selling over-the-counter medicines. Documenting and retaining accurate and legible records are part of excellent communication within our teams. A patient is usually empowered to make their own decisions when they are provided with support, sufficient knowledge, given adequate control for their own decisions, and resources to exercise their choice. And after evaluating the impact of their choice, pharmacy and the team members support their decision by discussing the different options. By redefining their relationship with patients, pharmacists help enhance patient engagement, so we do engage in more conversations than were just needed. We build a rapport with patients by listening carefully and acknowledging the patient's agenda without interrupting them and then speak our points. This is how we agree a shared agenda about their medicines and health management. We use appropriate language throughout our conversations, adapting to individual patients' needs. Information is shared in an open, honest, and non-discriminatory way. We understand that patients' attitudes, their values, and behaviors change with age, gender, ethnicity, and social background. By actively listening, we focus on patients' words and their non-verbal behaviors without interrupting. Effective questioning techniques and listening skills help us gather the required information. We manage patients' concerns in a sensitive way, and we identify the extent to which their family, friends, carers, and other health professionals are involved in the decisions relating to the patient's health, while respecting their right to confidentiality and providing further explanation where needed. So as we move from lowered number of people working in the pharmacy, reduced staff, to more robots in pharmacies, I'm not sure if this personal touch will be reduced or the processes will become more efficient. Time will tell. Robots can definitely reduce the physical work of picking the medicines, packaging, etc. However, the human and professional communication will still be the duty of the pharmacists and other healthcare professionals. More and more people are choosing to self-care with over-the-counter medicines, that is, going to a pharmacy for minor healthcare issues rather than waiting for a doctor's appointment. Around half of British people, Italians, Spaniards, and some Germans now intend to use pharmacists more in the future. This is quite reassuring about their trust in the pharmacies, and they are ready to pay for the over-the-counter treatment, which is quick and effective. Of course, if the treatment is not working after 2 weeks, they have to go to see their GP, but that allows them to get time to try out the over-the-counter medicine and time to get an appointment with the GP or the hospital. UK as a country encourages self-care. The Self-Care Aware campaign has to be playing for a number of years now. This is all for today. I will be back with more videos and audios about the role of community pharmacies and how people can get more value from visiting their local pharmacies and also applying for jobs at the local pharmacy. Have a good evening. Take care. Bye.